Hello, I'm recording this month's podcast from our stroke unit, and the reason I'm here is that from last Monday we have become one of only 3 hyperacute stroke units within Greater Manchester. This is very much following the model that London came up with some time ago, and the likelihood is that London has saved about 100 lives from stroke patients in a year, and in Greater Manchester we want to do at least as well as that. So the 3 stroke units are based at Stepping Hill Hospital, where I am, at Salford Royal and at Fairfield Hospital in Bury. The organisations now between them cover the full range of stroke services for people who have recently had a stroke. The district general hospitals will continue to provide the ongoing care, which is largely around rehabilitation. But in the first few days, where some really intensive acute care is needed, it will be those 3 units that provide that. Now, some of you might be saying, but we've always provided stroke. Well, we have, but not to the extent that we are just now. We will be providing stroke patient services for the whole of the south of Manchester, and we will be doing that 7 days a week, up to 16 hours a day on each of those occasions. Whereas in the past it's been very much a Monday to Friday, and we've not been covering as extensive hours. Outside of those 16 hours, Salford Royal, which is the major hyperacute stroke unit, will still care for patients, but the numbers of occasions where a patient suffers from a stroke outside of those core hours are very small. So that means the vast majority of our patients will in fact have the very, very best acute care if they're in the south of Manchester from ourselves here at Stepping Hill. A real credit to our clinicians who have provided such exemplar care up to now and into the future. Unfortunately, we continue to still have some significant challenges in other areas of patient access. The main one being the Accident and Emergency Department, which you know we've been struggling with over the winter period. Unfortunately, the demand is still continuing and numbers are still high. So that is causing us continued problems regarding our 4-hour wait. We remain very committed to working with our clinical commissioning group, with primary care and with social care to improve the discharge arrangements for patients. I've mentioned, and you'll have seen in the media, that often the problems associated in accident emergency is because there isn't the sufficient flow of patients through the hospital. So patients who do need to be admitted from an accident and emergency need a bed. Unfortunately, if there is a patient who is still awaiting discharge in that bed, it will slow the whole process. We're doing some excellent work in this area. We believe it is making a difference, but we need to make a greater difference. In terms of other access areas where we're struggling, the 62-day cancer target has been a real issue, and again that has been around high demand, often for very complex cancer patients. But again, we're working on improving our pathways, our processes to give that very best of care. And in outpatients, we've been undertaking a significant number of additional outpatients. And as a result of that, there have been some delays in both the diagnostic services that are very much necessary to an outpatient diagnostic, but also the letters that go out to GPs and patients about their outpatient consultation. It is a capacity issue, we are on top of it, but apologies to anybody who is perhaps waiting longer than we would want for their letter or their diagnostic care. Director of Finances are really important positions for organisations, and Bill Gregory, who had been here as our Director of Finance for 7 years, recently left the Trust to go to a mental health trust in Lancashire, and we absolutely wish him the very best. I'm delighted to say that we've been able to appoint an excellent Director of Finance in the name of Feroz Patel. Now, Feroz is currently the Deputy Director of Finance at Blackpool, where he's been working for 14 years. He's undertaken both acting Director of Finance and Deputy Director of Finance roles, and he has worked also in commissioning as well as the acute sector. A highly experienced individual with very much the kind of personality who I know will fit in very well with the board, the executive team and the hospital as a whole. Feroz should be joining us in the summer, and we hope that he will also be able to come and see us in the intervening period, particularly at some of the strategic sessions that the board might be having, rather than starting with a big bang in the summer. So as soon as he arrives, I'm sure I shall be introducing him to you, but in the meantime the podcast will be giving you a glamorous photograph of him, so you will know who he is when he arrives. The Stockport Health and Social Care Economy has recently been awarded something which is called Vanguard status. This is around a £200 million innovation fund, which is around financial support but also support in kind from NHS improvement areas. And 29 sites have been selected across the country, 2 of them in Greater Manchester, ourselves and Salford. This will allow us to do the work we were already going to be doing under Stockport Together, but more quickly. And that should mean that the changes that we want to bring in can be more quickly implemented within the borough. Now, Stockport Together is really about integrated care. It's about saying if health and social care can work together, focusing very much at the GP practice level, that can allow patients to be treated most locally to their own homes. Some of that care will absolutely still have to be delivered in hospital, but the majority of that care should be able to be delivered in primary care or in another community care setting. We're working in earnest around 4 pieces of work, one around prevention, one around looking after, on a proactive basis, those patients who have a long-term condition or some kind of chronic condition. We will also be looking at urgent care, where people have an accident or suddenly have an illness, and then finally around planned care, which is where you come into hospital perhaps for an outpatient or some kind of surgical operation. So we've got teams of clinicians and managers working in all of those areas from a number of organisations, mainly from the Foundation Trust, from the Clinical Commissioning Group, from Stockport Metropolitan Borough Council and from Pennine Care Mental Health Trust. But we're also very much involving the third sector, including particularly voluntary care organisations. So that's a piece of work that I'm sure I will be talking about more in future podcasts. But the great news at present is that we were going to be doing it anyway, and this really gives us a complete lift in being able to do it all faster and making that care difference all the more quickly. We were recently able to open a brand new play and garden area outside the children's treehouse here at Stepping Hill. There was a huge storm, you may well recall, in 2012, and as a result of that, so much damage was done to the previous play area that we've unfortunately not been able to allow children to go out into that area because it was unsafe. So fundraising began in earnest after that, and a campaign has led to £55,000 being raised. And there's particular thanks within that fundraising to Mediquick for Kids, who helped us achieve our target. The area has now got a sensory garden. It's got an area that is around road and traffic management, which hopefully will be good in helping health and safety matters with children. But it's also got some lovely giraffes and other animals for the children to play on. This was opened recently with a number of eminent guests appearing, and the big beneficiaries to this, of course, are the children. But thank you so much to all the donors that made this possible. Another fundraising event that we've had is around supporting dementia services, something that is a growing issue within the country, and indeed many of our patients are suffering from dementia, often along with other conditions. And one of the pieces of work that has been proposed is to have reminiscence areas. Now, these can be rooms such as somebody's sitting room, or it could be perhaps a pub or a shop. And the idea is it helps patients with dementia, who are often at the older end of the scale, remember things about when they were younger. And so these rooms are designed around 1950s, something I'm pleased to say I don't quite remember well, although in terms of dementia we know that that's not always older people. But these rooms have been fundraised by our own staff, often undertaking events, and by patients and members of the public. Each of these rooms costs £1,800, and so they're not cheap. We've got one so far, and that's based upon one of our elderly care wards, and has been a huge hit already. We're hoping to have more of these, and indeed go as far as having a dementia cafe, which would be a properly working cafe, and again would be something that I think our older patients would really enjoy and reminisce on. So thank you so much to the many staff who I know have been involved in the fundraising events, and to members of the public who have helped. I think this makes a big difference to patients who are suffering from dementia. We're celebrating a number of further achievements this month, and we've actually had 2 Student Nursing Times Award nominations, one from our district nursing team in Victoria and one from our ward E2, which is within the same building as I'm located at present, and which currently has the dementia sitting room on it. Stockport health visitors have been given due recognition for being the very best in Greater Manchester for leadership and management of services. So well done to them, because it's a much needed service for all of the patients that they are helping to remain in the community. In addition, it's a big plus as a new role. Jane Etches, who is one of our district nurses, has got a role which we understand to be the first of its kind. That is, she's out there training and supporting residential and nursing homes in the care of patients to avoid pressure ulcers. Something that are really difficult to care for and treat, and so the more we can do to actually avoid those in the first place, the better. And Jane's role is the first that we know of, and we're hoping to see huge improvements to often elderly patients in our nursing homes and our residential homes. And finally, something you might well have seen recently in the media. We had a marriage in a hospital ward, in a hospital bed, conducted by our very own hospital chaplains. Unfortunately, a lady who was admitted to the hospital and whose health was deteriorating wanted to be married. She had a fiancé, and because her health was in such a poor state, she wanted to tie the knot there and then. And so we pulled everything together to ensure that they could have a proper wedding, and they were married. And what is even better is that since that time, the patient's health has significantly improved. The patient is now back home, and we wish her and her new husband the very, very best wishes for the future.